Welcome back to the Riley Perspective. Good to have you with us. Okay, how many people say get some backbone? I want to tell you a quick story. 1992, I had a spinal cord injury, and I had disc herniation, L5, S1. They had to go in and they had to do a thing where they cut out this part of my spine and to be able to release the pressure. And I was paralyzed from the waist down for a while, and had to learn how to walk again, had to learn how to do a lot of things again at the age of 32 years of age. And, you know, I didn't know, I thought my life was over as it was, but I was in the middle of it. And something as simple as you look at something like this and you think, what story can it have? Well, it has a big story. Do you suffer with back pain? Do you suffer with chronic lower back issues or upper back issues? And have you tried everything else that's out there? Have you tried different things? And maybe you haven't tried this thing called decompression or laser therapy. And I've just come to learn about it, and I'm quite fascinated. And I want you to learn about it tonight, too. Dr. Pardisnia is with me. He's from Simply Aligned Rehab. Good to have you with us.
Thank you. Thank you for inviting me.
You are a chiropractor?
Yes.
And a physiotherapist?
Yes.
And a lecturer?
Yes.
And a teacher?
Yes.
You specialize in many things, but decompression is something that you've become very well known for?
Yes. Yes.
So, first of all, welcome to the show. And you're not far away?
No. I didn't know. I'm very close to here. I'm about half an hour, 20 minutes, half an hour away, yeah.
Let's jump into this for a moment. You know, as I tell you my story as we went into the air, I mean, I was, you know, there I was. I had a catastrophic issue happen to my back. Yeah. And I didn't see it coming. I didn't know it was coming, and then all of a sudden here I was. There are people now watching right now that have back issues that they've tried chiropractic. Yep. They've tried different things. They've tried acupuncture. They're maybe not getting the results that they want.
Right.
So I didn't want this to be like a typical chiropractic show where, you know, we'd say, okay, here's how your spine works.
Yeah.
I mean, we got that.
Yeah, yeah.
Right? But we'll talk about how the ways we injure it sometimes, and sometimes it's just by sitting or head forward position that we're going to. You're seeing it all, but I want to talk a little bit about what you decided to make a break for it and change up your practice a bit.
Yes.
Why was that?
Well, when I went to school, in a chiropractic school, when I went, 2000 I graduated, so in 1997, 98, 99, and 2000, we learned about nerve impingement, and that's a chiropractic talk that you're talking about. Everybody's talking about, oh, you go, there's a nerve impingement here, and the chiropractor's job is to remove that nerve impingement. Right. It's not that easy, because as you can see in your case, you had the surgery you're indicating is laminectomy, where they go and cut the lamina and then they relieve the discs. So they're trying to get over they cut the lamina here, so that will allow the surgeon to go and clear the discs and take the nerve impingement or nerve pressure off. Right. So in a chiropractic school, if it's a perfect world, we can do that with adjustments all the time, and sometimes we do. But a lot of times it doesn't happen. So when I graduated, I bought this table called the flexion table, which a lot of chiropractors use. It goes up and down, and I thought that would give that motion. Again, it was hit and miss. Then we bought a...
So you were hoping by the flexion table that would actually create a better range of motion, and opening?
Yeah, opening and pull the disc back into place. Okay. And it does do that sometimes. Then I went to physiotherapy school, and we studied about McKenzie technique, which are the extensions. Right. So a lot of time you talk to medical doctors or physiotherapists, they talk about McKenzie extensions, where if the disc is coming out this way, by putting extension on your back, you're pushing the disc back inside. Okay. Yeah, so that and you hold that position, and those are McKenzie exercises. Again, to me, maybe I wasn't that good. I was hit and miss, to be honest.
So you were getting the results.
I wasn't getting the results, and one day I was looking on the internet, and I looked up and this thing about spinal decompression, which is a computerized traction. And I was one of the first ones that bought the table in Canada, and I brought it over, and Vitality Depot picked it up afterwards. So what this technology does is that you lie down on the table, and you are well, that's a good thing about the table we use. Okay. You can be face up or down, and then it also rotates and twists all kinds of motion. So you can address the McKenzie technique with the traction. Okay. So you can put them in a face down, put extension, face down, the patient is lying down, face down, put extension, and then pull this way, allowing that disc to kind of go back inside. And if you do the exercise afterwards, you can hold it. So it's been a revolutionary kind of in my world.
How long have you been using it?
Oh, since 2000, and I forget now, 2007, 2000, it's been many years now we've been using it.
Well, we're going to throw, I mean, there's some pictures at the table that we'll go to where you can see on
Yeah.
the screen here. So that's one right now. It's called
Yes,
Talk.
that's my...
So someone's laying on this. Now,
Yeah.
there's no, you're not with this at this
No,
moment.
no.
If you program, this is on a
Yeah,
program?
yes, it's a program, yeah.
Okay, so in this case here, this person's laying down.
Yeah.
And they are now experiencing what? The base is
It's yeah. So the split in the table that you see, it's going to pull, and it's all programmed inside. And the table has a bunch of sensors. It measures the weight, rotation, flexion, and extension and your orientation. And we tell it what to do, and it will pull the disc, and it allows a vacuum phenomenon to be created.
A vacuum
A
phenomenon.
vacuum, a vacuum. So as the disc kind of gets pulled back into the place.
So there's a space.
Yes.
It gets sucked back in? Is
Exactly. So
really?
if this is on which camera?
Okay, no,
this one?
you're
Yeah.
good.
So if we are
right
here,
in front of you.
if we're here, right here. So this is a normal. Nothing is happening. This is a disc right here.
Yep.
If I push that, there's a crack here, which is probably what you had. And if I push it here, you see the disc material comes out like a jelly.
Right.
And if that jelly hits the nerve, that pain shoots down the leg below the knee. That's called sciatic nerve, sciatic pain. And if I was going to, it's not that hard to understand. If I put them like this and I pull it back, you can see the disc is going back right in this model.
But some people, so that makes sense to me. But I was also doing, I won't say. Here's my expertise. I know things about an inch deep and about 10 miles wide.
Yeah.
So I know enough to ask a few
Yes,
questions.
go ahead.
In this case here, there is a thing called traction tables.
Yes.
And I look at them, it almost looks like a machine that's pulling the dent out of a bumper.
Right.
It almost, because there's a pulley at one end,
yeah.
and then you're wired up to this thing and it's pulling on you.
Right.
That scares the heck out of me.
Oh, no.
No, it shouldn't?
No, people fall asleep on this.
No, I'm talking about the traction machine by itself.
Oh, the traction machine.
The ones that
the older ones?
Yeah, there's ones where you have that head there where it's the pulley system.
Oh, yeah. So, well, because they're not as specific as the spinal decompression, they pull the whole spine. They can just work as well, but this is a newer technology. So we have more sensors in there and we can program it. And the old tractions, the good old tractions, you would have a ramp up. So you would you say, okay, I'm going to pull you for 20 minutes, and I'm going to have you pull for 30 seconds increments.
Okay.
And that's all it would do, and it would leave the patient. And sometimes it made the patient worse because it was too much. These new technologies have sensors, so they can feel how much pull is actually being applied to the spine. Not with a great detail, but somewhat of a detail, and it can go back and forth and can release, so it won't be over pulling the spine, so it won't cause spasm as much.
So this was something I found also interesting because I believe in chiropractic.
Yes.
And so I'm not a disbeliever,
Yeah.
and I appreciate what can be done. Some people are very concerned about that physical manipulation.
Yes.
Other people have it with the activator, and I've seen that, and I've experienced that as well. A lot of people will never go see a chiropractor because they say once you go, you can never get free.
Right.
Other people are worried they're going to go and it's going to be the worst experience of their life.
Right.
When I started to learn about this technology, this decompression table, and when I started to read stories about it, it's attracting people that never would have gone to chiropractic otherwise.
That's right, because they're relying on a table to do it, not a chiropractor. So again, a machine is doing it, and if you program the machine, it can only, the chance of it's a consistency, and also there has a kill switch. You can hit it, and it will. And if you're going to get worse, you will get worse right there. So you can stop it right there. So it's not going to be something 3-4 days. I'm on a decompression. I couldn't move afterwards.
Right.
And people looking at I'm going there for an expert to apply spinal decompression. Now, mind you, spinal decompression in the United States a lot of times done by medical doctors. The medical doctors who have it in Europe is done by medical doctors sometimes. Here you can have a medical doctor who's not licensed in Canada, but they run spinal decompression centers. Physiotherapists use spinal decompression, so it could be anybody does the spinal decompression technology.
What are the things have you seen? Like people have come to you. Give us, obviously no identifying information, but someone has come to you and they're messed up.
Going back to my original story, once we got this technology, it felt like I could work with this finally, removing this nerve impingement clearly with the disc problem. So we've had people that were, I think we've had 2-3 surgical candidates that we got them out of that with the spinal decompression.
So they were actually
they were booked. They already booked for surgery. They had a date and they came for decompression, and they didn't have to have the surgery. 2-3 times that has happened. And we've had many patients that were not surgical candidates but were living with this pain. And we've gotten better with the spinal decompression, with the laser and the exercise. Mind you, everything has to go together. It is not just the decompression.
It's not by itself. You got to do some work.
No, it very rarely. It does work by itself. Right. We have patients that I just want that, doc. I don't want anything else, and it works for me, and I don't want you to touch anything. I just want to come on that table, go on it for 15 minutes, 20 minutes, and leave. And that's fine. But usually it goes with exercises, because as soon as you stand up, that disc is loaded again.
Right.
So this can slip back out again. So if you don't have the core stabilization going in there, this spinal decompression can only do, and that's a failure of the practitioners who sometimes, you go for spinal decompression, doesn't work because they don't have the proper exercises.
But the customer is also, the patient has to want to do the exercise.
Oh yes, it's mandatory in our thing. I mean, I tell them, just don't come to me if you're not going to do the exercises.
Really? You fire your patient?
Oh, well, yeah, of course, yeah. I don't have time. We're busy. We're a busy center. We got busy in the past 2 years when we brought the class 4 laser, which heals deep inside. I think all spinal decompression clinics out there have a laser unit with them now. I don't think anybody does spinal decompression alone, and a lot of them should do proper exercises.
Let's go back to this decompressions. One of the things when I was reading about it was it talked about the fact that it could actually sense when the patient was tightening up, when the patient was starting to resist, and that was something that struck me as very interesting.
Yes.
Is that accurate?
Yes. The table
so when someone's on that table,
yeah,
and all of a sudden they start to feel, and they don't know it, but their body's tightening up. The technology
senses it,
yeah, and actually shuts the program down.
Yes, it reduces it. Yes.
Okay, that's great. We're going to go off to break. When we come back from break, I want to talk a little bit more about decompression.
Sure.
I want you and then I also want to talk about the laser idea, about some of that deep healing, and really, what people could expect and who shouldn't do this, because there's also got to be those.
That's right.
All right, we'll be back. We're talking about back issues. Maybe there's some solutions here for you. We'll be right back with the Roddy Perspective right after this. Welcome back to the Roddy Perspective. Good to have you with us. We're talking about your back. We're talking about issues that you may have with your back. You've been suffering, back, knee, joint, anything else. Maybe you need to try something different, and chiropractor may scare you. But there's decompression available, and the good doctor is good to see you here. Thank you for coming in. I wanted you on because you're a specialist in decompression.
Yes.
So when we went to break, we wanted to come back and talk about who should consider decompression. But maybe before we do that, let's just walk through the protocol. If somebody comes to see you, tell me what they can experience, then we'll find out who should and who shouldn't. Yeah,
so we do a thorough exam at the beginning when the people come in, and I think that's very important to find out exactly if they're a candidate for decompression. Sometimes you just have you were gardening and you just have a back spasm. You don't have to go on that table. In fact, if you go on the table, it may make it worse because you're pulling on the already pulled muscles. So if it's just a muscle pain or a small ache, you would succeed very well with just chiropractic treatments or some exercise and stuff like that. After that, we give you activity modification. A lot of patients we have is that they've been through everything. They've gone through chiropractors, physiotherapists, acupuncturists. They've taken medication. They're just, their back is against the wall literally, and they end up in our center. So we go through breaking down what they are doing wrong, how they're sitting, how they're lifting, how they're brushing their teeth, how they're pushing, pulling. All those things put the pressure on the discs, and the disc is pushed up. So if you're standing for too long and you putting pressure on a disc in an abnormal way, the disc comes out again.
And
that could be just standing in the wrong way,
just
brushing your teeth for 2 or 3 minutes, and you have shooting pain down the leg.
Seriously.
You must have had that before the surgery. Sometimes you have it constantly, and that's when the surgery comes, because there's nothing that alleviates it.
And nobody can quantify that pain.
No, people.
This is the crazy part.
Ladies who've had childbirth, they say it's worse than child. They wish they could have babies than have that pain because it's so excruciating.
I remember when I had the pain. and it was shooting down the back. I wanted, if I could have cut my leg off, I would have.
Yeah.
That's what I felt
hear,
like.
yes. Yes.
So now, you evaluate if people are candidates for decompression,
Yes.
which is important. The second part is now they have to do modification, and you're going to show them they're doing things. We have a new phenomenon in the last 5 or 10 years, 5 years anyways, for sure. We have these phones that weigh quite a bit, and we have the first time in the history of mankind more people in head-forward position.
Yeah.
And they're saying that you're seeing degenerative disc issues that would common to 50 and 60-year-olds are now happening in kids in their 20s.
That's right, because you add so much weight, and we call it
just anterior.
Yeah, just anterior head forward carriage. But just by going 1 inch, you add about 10 pounds or so just to your spine. Just by going 2 inches, it'd be a lot more than that. So that could cause neck disc herniations, which we do spinal decompression for the neck, not just the lower back.
Okay.
So you would be lying on the same machine that has a completely separate motor system and protocols for the neck, and we would pull that. Or it could cause degeneration of the neck, which is awful. So you're better off to text like that, or try to not text as much as you can. So try to reduce it or read it. But you can, those are good things to do.
There's a storm coming up. There is a storm coming, isn't there?
Yes, because everyone at age it will if they decrease it by 10 years, let's say. So you were supposed to get arthritis of the neck at age 50 or 60, and you get it at 40 or late 30s. That's crazy. There'd be so many people with neck pains, and there's no going back, of course, from arthritis. I mean, we have a better chance with decompression to fix a disc than the arthritis.
Seriously?
Because once the arthritis is there, it's there permanently.
And what modality can somebody use?
They can do, again, they can go to physiotherapy or chiropractic or acupuncture, all those things with arthritis. But at that point, a good posture will just reduce your progress in arthritis, because you already started it.
Right.
So it's very important to catch these things early, so you never have to see me.
Right.
Right? I mean, that's what the point.
Well, let's go back to this, because you've dealt with this. Everybody says, I want to see a chiropractor. You never get away from those guys. It's kind of like your new drug dealer.
All right.
That you can get hooked. You've heard it.
Yes.
I mean, so how do you respond to that? Because I know that's not true.
Yes,
But how do you help someone get past that?
Well, I think that people have to recognize that, when you go to a doctor or a dentist and the dentist messes up your teeth, and you go to a doctor and they give you a wrong prescription and mess you up, you don't stop going to doctors. You don't stop going to the dentist. But for some reason, chiropractic and physiotherapy and acupuncture has that. Once you go to one acupuncturist, that's it. You've seen them all and you've tried it.
Right.
But that's not true, as we know. So there are two classes of chiropractors. One, the straight chiropractors, and ones like me who mixes other things like laser and spinal decompression and exercise. Straight chiropractors are the ones you're probably talking about, that you have to go regularly because they want to maintain a healthy spine, and they're very good at that. So healthy people go to stay healthy. And if you're hurt, you can go and get better, but they want you to keep coming back. Here, I be honest, I recommend many of my spinal decompression people to come once every 3 weeks, to come once a month, to be reminded of exercises, to be reminded of activity modification, and to be reminded how bad they used to have it, because they forget how bad it was.
The body remembers homeostasis pretty quickly, right?
That's right.
I always say to people, do you remember when you smacked your toe on the cement? They say, I remember. I said, do you remember when you stopped limping? And they say, no, because the body is designed to get back into action.
Yes.
Let's talk about lasers.
Yes.
I just want to do that thing from lasers.
Yeah.
But class 4 laser, it's a powerful machine. Tell us the people getting, what would they experience when they use a laser, and why do you use a laser? First of all, what would they experience?
Yeah, I've got in my office gone through 1, 2, maybe 4 different lasers, and we started one of some of the cheaper models that when I was younger I could afford to buy for my practice, so I bought a cheaper model, and I thought they work well. They never did anything. Then we upgraded to the pulse laser, which was okay, but you had to leave it on for 15, 20 minutes, and it never had the depth. And then we were introduced to class 4 laser a couple of years ago, and that people definitely recommend help with it. So we leave it with the class 4 laser are done usually 2 minutes, 4 minutes, 6 minutes sometimes, and it heals at the cellular level.
So let's talk about that for a moment, because a lot of people think that the deep tissue at the cellular level. People talk about tissues. You're talking about cellular.
Cellular level, yes.
A class 4 laser can cause that to happen.
Yes.
Is there anything else that can do that?
You know what? That's the biggest thing right now. I mean, stem cell research is at the cellular level.
Right.
PRP, which is the platelet-rich injections, that's
Yes.
coming up from Europe, and it's very common now in America,
Yep.
U.S., and it's
US.
coming to Canada.
Yeah, Mayo Clinic.
Again, it's at the cellular level. Lasers at cellular level. Shock wave at the cellular level. All these treatments are at cellular level.
Let's talk about those couple of things, because I was at a place where they were at Vitality, and they were doing a demonstration on the shockwave, and they just, now I have trigger finger.
Yeah.
Right?
Yeah.
I didn't know, 50, all of a sudden, this one started doing this, right?
Yeah, yeah.
And all of a sudden I was like, oh my gosh, what do I do about this?
Yes, yeah. And you just shock.
So at the demonstration, they did this, and I could feel an improvement. Now, I haven't gone back to,
Yes.
I haven't gone to see, I got to come and see you, I guess, because we don't do that at our office, but I was shocked.
Yes.
I was shocked so that was interesting, because the theory behind that was, it's a projectile that's inside this thing that causes micro tears.
Yeah.
Is that right?
That's right.
That causes the body to take action to heal.
To heal.
And when it's healing those micro tears, it's actually healing the other injury?
Yes, yes.
Would that be right?
Yeah, well, it's causing many things. It actually, what it brings is, it can break down, if it has a scar tissue there, it can break it down.
Seriously?
At the cellular level, it can reduce the substance P, which is the pain hormone inside the cell. It can actually knock it outside the cell. It can change the morphology of the cells because it's hitting it so fast and so quickly. I believe, this is not researched. Again, this is a problem with our profession because we're not pharmaceutically owned,
Right.
so nobody's going to spend the time to do a lot of research in our profession.
Right.
But we must be changing something at cellular level, because when we do spinal decompression with conjunctions of laser, people heal faster, a lot faster.
They see an improvement.
Yeah, it's not the TENS machines that you put on people and it just knocks the pain out for half an hour or 20 minutes, which is very useful when you have a spasm.
Right.
But they're not changing anything morphologically. Ultrasound, for example, is a deep heat, the thermal energy. It makes you feel better for a few days, but usually the pain comes back. But these things, the shock wave, laser therapy, magnetic therapy, all these things are at the cellular level because people have had chronic pain for a long time, and they start feeling better. So we must be getting way deeper with these technologies.
So how do someone who's watching this show is a chronic pain sufferer,
Right.
and they think they know where it's originating from. They come and see you.
Right.
You do an evaluation, or somebody who has a decompression. I mean, right? Because there's other people now that are doing it.
That's right.
So to be fair, and when could they start to see an improvement? Because that's the other part. People want to see an improvement.
Well, when we combine the technologies together, let's say if somebody comes and have a bad shoulder, I would maybe do laser,
like a rotator cuff
ultrasound,
issue.
rotator cuff.
Very common.
Yeah, I would do all three sometimes. In the same day, I would do laser, shock pulse wave, and I would do ultrasound, and I would give them the exercises. I get upset if they don't get better within 2-3 visits.
Really?
2-3 visits, I want to see. I'm like, I take it personally if people don't get better within 2-3 visits. Decompression takes longer because these are chronic issues. The disc is way deep in there. We have to get in there, so we have to do a lot of activity modifications and decompression. So that after 2 weeks, I will get upset.
Okay, well that's fair.
But with a knee pain or a shoulder pain or a neck pain, smaller joints or hand, I want them 2-3 visits. I want them to see an improvement.
So let me ask you a question. There's a lot of people out there waiting on hip replacements and all kinds of things. Is there something that they could be doing proactively in the technologies that you have, or are they too far gone?
The hips is a little bit more difficult because knee replacement we can help, but the hip replacement is a deep joint. So again, we work with a lot of doctors, and my location is in a medical center. So if a surgeon, for example, suggested hip replacement, that's what you may need. So some of these machines may not be working at that point. The joint is completely gone. So none of the spinal decompression, or I should say that very, very concretely, that none of the technologies we have is to replace surgeries. But yes, if you're at a borderline, you don't want to go for surgery, you're not sure if that's a thing for you, you can definitely try a good physiotherapist or a chiropractor who has some technology and some exercises.
I think the technology is important, and it's kind of ridiculous to ignore it now.
Yes.
Considering.
Yeah.
I mean, considering what we can do with this.
Right.
we should be able to think that the technology would work. Last, just before we go, we got about 30 seconds left. What's the best thing for people to do? I mean, step one is do research, or should they call you?
Yeah, take a look around. Try to find a clinic that you feel a connection with the practitioner, and it's not a money-making clinic.
Proposition.
Yeah, because spinal decompression has a bad reputation of trying to push a lot of plans on people and so on.
So it'd be good to find somebody who's not that way.
Yeah.
Doctor, good to have you with us.
Thank you so much.
Pardisnia,
Yes.
good to have you with us. And I want to thank you for tuning in to the Riley Perspective, and hopefully we've helped. See you next time.